Hi everyone, in this video I'll be presenting on engorgement and there will be a following video on twins. Engorgement occurs when the breasts become too full with milk and fluid. Primary engorgement usually happens 3 to 5 days after the delivery with the onset of stage 2 lactogenesis and is often related to the decreased progesterone from placental delivery. Secondary engorgement occurs when there's a mismatch in production and extraction of milk from the breasts. The mom might be making a normal amount of milk, but the baby's unable to effectively transfer and remove the milk. It could be due to excessive stimulation from pumping, medications that increase the milk supply like domperidone. Oversupply also occurs when feeds are very short and the baby is being switched from each breast too soon. So oftentimes moms are told to switch sides when the baby becomes fussy, but a problem with that is that you've already stimulated one breast. So these are the common signs and symptoms that you'll notice in your assessment of mothers with engorgement. When you're assessing the mom, you should ask her how her breasts feel. They'll often report that they're firm, warm, throbbing, or even painful. Engorgement can be affecting one breast or both breasts. Sometimes it's only the areola or the peripheries that are affected, or it could be the whole breast that's engorged. In this picture, you can see that the woman's breast is shiny and taut from engorgement, especially around her areola. This impacts the effectiveness of breastfeeding as it impairs the baby's ability to latch, and it worsens the engorgement by decreasing the milk transfer. So be sure to assess if it is hard, as it would require reverse pressure softening before feeding a baby. Women with engorgement can have an increased temperature of up to 38 degrees, so it's important to rule out postpartum infection as it could result in the separation of mom and baby. Another consideration when assessing the mother for engorgement is to see if there's swelling in other parts of her body. Sometimes women are given IV fluids during a complicated or prolonged labor, and this can increase overall body fluid load and reduce the body's ability to process excess fluid. Also, be sure to ask the mom how often and long they breastfeed to see if baby falls asleep after feeds or during feeds, and how much time do they spend with each other at the breast. The 3 priorities for care when working with a mother who is engorged would include ensuring that there's adequate milk removal to relieve the engorgement, equipping the mother with feeding techniques like reverse pressure softening and positioning tips that can facilitate breastfeeding while engorged, and providing her with tips for managing pain and discomfort that's often associated with engorgement. With engorgement, we want to stress the importance of continuing to breastfeed and emptying the breast of milk. When the areola is involved, you can advise the mom to manually express small amounts of milk and do reverse pressure softening, which we'll go over in the next slide. We also want to let the mom know that it's important to let the baby finish feeding on the first side before offering the other to make sure that there's effective emptying of the breast that's being fed. Lots of moms are told to ensure that the baby feeds from each breast, so they'll switch between a feed. But after milk supply has already been established, the baby can lead the feeds and they'll let you know when they're done on one side. Some babies will often come off the breast on their own and they seem satisfied, or they just won't drink anymore from that side, even with breast compressions. So letting the unfed breast become a little full as it waits to be drained allows the inhibiting factors in the breast to slow the milk production down. This is especially important with mothers who have oversupply issues. Breast compressions and hand expressions during feeds while the infant is suckling can enhance milk transfer and breast emptying. Breast pump use to remove milk is recommended to be limited only immediately before a feed to soften the breast. Overuse of the breast pump can actually stimulate milk production and it can increase engorgement. A breastfeeding baby can actually remove the milk more effectively than the pump. Of course, sometimes if the baby isn't feeding well due to jaundice or illness, you should be using the breast pump to express milk. During these times, it's recommended that mothers express 8 or more times in 24 hours to prevent engorgement. Other tips you can give moms to prevent engorgement is to feed 10 or more times in 24 hours, ensure that the latch is satisfactory, and to breastfeed the baby based on hunger cues. Reverse pressure softening is a technique that mothers need to use in order to ensure that the baby is able to latch onto the engorged breast. Prior to doing this, moms want to compress the breast with something warm. This helps with the reverse pressure softening and for enhancing the letdown of milk. A laid back position is also recommended, so the baby is laying tummy down on the mother's semi-reclined body. This allows gravity to draw the breast swelling back into the body. So with reverse pressure softening, you want to first apply a warm compress to soften the breast. I have a breast here, so I will demonstrate. So with the two-handed method, you want to have your fingernails short and the fingertips curved, and then each one touching the side of the nipple. So placing the fingers around the nipple, press towards the chest wall. This should be held for about 50 seconds, and when you release, the edema around the areola should be reduced, allowing it to be a little bit more malleable for the breast to be latched by baby. Hand expression and breast pumping to empty the breast a little bit before feeding is also recommended. So for pain management and comfort, similarly to earlier, we want the mom to make sure that she's using a warm compress before a feed. Having a warm compress or a hot shower enhances the letdown reflex. For cold compresses, they're often used after or between feeds. This helps decrease the swelling and discomfort. Vancouver Coastal Health recommends using gel packs, diapers, or pads soaked with water and chilled, and leaving these on your breast for about 20 minutes at a time. Of course, we've seen the classic cabbage leaves inside the bra, but studies have actually shown that there's no evidence for cabbage or lettuce in reducing engorgement physiologically. It's mostly just for comfort. Analgesics like ibuprofen can also be used, but make sure to recommend moms to read the directions before using. Engorgement usually resolves after a few days at most. If it does last longer, make sure the mom is seeing their healthcare provider or a lactation consultant. Evaluation of breastfeeding treatment and support that was given should include an assessment of seeing if the engorgement has resolved, how the mom is feeling with her reestablished breastfeeding routine, ensuring that the baby is feeding well and growing and gaining weight, assessing to see if there's any latch problems or nipple pain and trauma from the engorgement, and ensuring that there's no signs of mastitis. So now I'll begin my presentation on breastfeeding with twins. Over the years, there has been an increase in twin births worldwide due to the availability and use of reproductive technologies. Oftentimes, mothers of twins or multiples will face more challenges with feeding their infant than mothers of singletons. We see this with very low rates of exclusive breastfeeding in twins for about 6 months. So the range is around 4 to 6%. Pregnancies with multiples are generally associated with greater risks, in which there's a 50% risk of preterm birth, and often multiples are delivered by C-section. We know that breastfeeding premature infants is also associated with a decrease in postnatal complications like sepsis and necrotizing enterocolitis. We also know that the breast milk made for premature infants is specifically designed for their needs. So it's especially important to support mothers with twins through breastfeeding for as long as possible. And knowing some of the common problems these mothers and twins experience can allow us to provide early intervention and therefore promote the continuation of breastfeeding. Priorities of care that I've chosen for breastfeeding twins is to establish an adequate milk supply and ensure that mothers know that it's possible to have enough milk for twins. Mothers of twins may also want to consider feeding simultaneously to save time, so you may be asked whether it's best to feed the twins together or separately. And the third priority is to ensure that care and support is individualized to the mother, as twins and multiple births often have complications that affect the breastfeeding experience. Many studies have shown that mothers of twins are more likely than mothers of singletons to perceive their milk supply as insufficient. Most mothers can produce enough milk to breastfeed 2 or more babies, and it's important to reinforce that breast milk is adequate to support the needs of preterm infants. Because there's a 50% risk of preterm birth in multiple pregnancies and birth via cesarean, it's likely that the mother and infants will be separated after birth, as a preterm twin or both twins could be sent to the NICU. The use of formula to supplement in the NICU can also exacerbate the anxiety that mothers have about insufficient and inadequate breast milk. It's especially important to reinforce with mothers of twins that they can produce enough breast milk for both babies and even more, using the 3 E's and effective milk removal knowledge that we have. These are concepts that were covered in modules 2B and 3A, so I won't be going over them. For this priority, be sure that there's skin-to-skin contact and the first feed is initiated for both babies as soon as possible. Advise mothers to express milk by hand or pump early, and to increase the frequency of pumping within the night. A quick Google search for breastfeeding twins will pull up mostly pictures of moms breastfeeding their twins together. It's recommended actually to feed the babies one at a time until they learn to latch onto the breasts. It's quite difficult to manage simultaneous feeding if 2 hands are needed to ensure a satisfactory latch with the baby. Until the mother is able to easily position and help individual twins latch one at a time, and until one baby can latch itself with little help, the mother should continue feeding separately. Mothers of twins have extra demands of frequent suckling and often will have to coordinate with the different feeding needs of each baby. Breastfeeding can become more physically and emotionally challenging for these moms in particular. So when babies have different feeding needs, for example, one baby might be supplementing working with formula, extra time will be required to make up the formula fees as it takes time to prepare and clean equipment. Mothers of twins have also been previously told to offer one breast to one baby and the other to the second baby. There is no rule for breastfeeding babies exclusively to a particular breast, but changing the positions can actually help nourish babies equitably, as different breasts may have different milk production and storing capacity. Alternating breasts might assure that there is sufficient stimulation to the breast and equal milk production. A consideration with feeding twins together simultaneously is that it's likely to stimulate a simultaneous letdown in both breasts. This is particularly good if one infant has weak sucking. Feeding twins on a schedule is also something that mothers do to save time, but do recommend that mothers first establish a regular milk supply and breastfeeding with each baby before scheduled feeds. Another issue with scheduled feeds is that you'll have to wake up a baby for a simultaneous feeding, and this might be difficult and often leads to a unsatisfactory feed. There are a variety of positions that mother can use to feed twins together, which I will not be going over in this presentation as they can be easily googled. I hope that the pictures throughout the slides have given you an idea about the positions that are available. The third priority that I've chosen is ensuring that the mother has individualized support, as the birth of twins or multiples is often complicated by prematurity and cesarean section. For breastfeeding one baby at a time, the mother can feed it in a side-lying position. If the mother chooses to feed simultaneously with assistance, she can use a twin or double football hold. Breastfeeding issues from a cesarean delivery can be further exacerbated by the degree of prematurity and the severity of any additional illnesses that the baby or babies may experience. With premature infants, it's especially important to emphasize early and continuous skin-to-skin contact. This can be difficult with premature babies, especially if they are being sent to the NICU, and it can be difficult with two babies at once, so ensure that the mother's partner and support system is also involved. It's been shown that counseling women who intend to formula feed about the benefits of expressing milk for very low birth weight babies and preterm babies can actually increase the incidence of lactation initiation and breast milk feeding without increasing maternal stress and anxiety. While feeding at the breast may not be possible due to the additional challenges of prematurity, mothers should still be encouraged to express her own milk to establish a milk supply. In cases where the infant is unable to feed at the breast, the baby should be fed with express breast milk or donor milk with a cup, tube, or bottle. Feeding express breast milk with a cup and tube are options that may actually increase the chances of the baby successfully feeding at the breast. The World Health Organization does not recommend the use of pacifiers to infants, and this should be discussed with mothers. There is evidence, however, showing that the use of pacifiers may be recommended to help preterm infants in the NICU accelerate their transition to full breastfeeding. If parents do choose to use pacifiers, recommend that they give their infants the pacifiers only after a good feed to ensure that they're not hiding any feeding cues. These are the references that I've used for my presentation, and this concludes my presentation on engorgement in twins.